Understanding pregnancy tests, timing and accuracy.
Hello there. Today, we're discussing a common question about pregnancy tests. How soon after touching your stomach can you take a pregnancy test? While the phrasing might be a bit confusing, let's unpack it together. We'll be discussing when is the right time to take a pregnancy test for the most accurate results.
How does a pregnancy test work?
To start, it's essential to understand how pregnancy tests work. Pregnancy tests detect the presence of a hormone called human chorionic gonadotropin, HCG. This hormone is produced by the placenta after the embryo attaches to the uterine lining, which typically occurs about 9 to 10 days after ovulation.
Can touching your stomach determine pregnancy?
Now, let's address the concept of touching your stomach to detect pregnancy. It's important to note that there are no physical signs or feelings in your stomach that can reliably indicate pregnancy within days of conception. Changes like a swollen or firm stomach usually happen later in pregnancy and are not reliable indicators of early pregnancy.
When should you take a pregnancy test?
So, when should you take a pregnancy test? The most accurate time to take a pregnancy test is 1 week after your missed period. At this point, HCG levels will have risen enough in most pregnant women to be detected by a pregnancy test. If you test too soon, the HCG levels might not be high enough to be detected, resulting in a false negative.
What if the pregnancy test is negative?
If you take a pregnancy test and the result is negative, but you still believe you might be pregnant, you should wait a few days and test again. This gives your body more time to produce HCG if you are indeed pregnant. If you're unsure, it's always best to consult a healthcare professional. In conclusion, timing is crucial when it comes to taking a pregnancy test. Touching your stomach is not a reliable way to determine if you're pregnant or not. The best time to take a pregnancy test is about a week after a missed period, and if you're unsure, consider reaching out to a healthcare provider. Thank you for joining us in this discussion, and we hope it has been helpful.